Well, it's good to be in Exuma and to be at this beautiful clinic. I don't know if you're aware, but the government is now in the process of renovating some 52 clinics. Exuma is one of those clinics. And I'm here with my technical team along with the Acting Director of Public Health, Dr. Philip Swan, where we are making some assessments of our technical team on the ground as part of a program for preventive care and the replacement of some aging infrastructure. Well, it's good to be in Abaco, and it's good to be witnessing for the first time in Abaco surgical procedures being done at the Marsh Harbor Clinic. First of all, it's historical, and second of all, the residents of Abaco are so grateful. I'd like to take this opportunity to thank the entire staff here at the Marsh Harbor Clinic for the hard work that they've been doing, as well as the two members of Parliament who are responsible for Abaco. Through this philanthropic effort, we are now doing cataract surgeries in Abaco, and the Prime Minister has just toured the facility to see the operating theaters in full operation. Me and Dr. Swan just flew in from Exuma because if you don't know, the Abaco Clinic is a sister clinic of the Exuma Clinic, and so what you would see here in Abaco is pretty much the same as what you would see in Exuma.
We have both the Liquid Legacy and the World Cataract Foundation that has come into Abaco to do this work of eye training and eye surgeries afterwards. And of course, the follow-up is going to happen after that. And as Minister mentioned earlier, the Ministry of Health is keen on trying to expand and give access to as many persons to services that we are unable to provide in the country. So partnering with external groupings, once we can verify their legitimacy, is one of the ways that we tend to try to, in the interim, fill the gap for those specialties and services that we're unable to give directly.
Well, personally and professionally, I'm excited because I have family members here who have had surgeries done, my aunts and cousins. So I'm excited for them, and they seem to be progressing well. And professionally, it's a pleasure. We have a very lovely facility, and it's making sense right now.
Right, so this clinic has been here since 2017, and today is such a groundbreaking event because it's the first time we're using the operating theater. So the staff morale has boosted tremendously here with the Liquid Legacy and the World Cataract Foundation, and I'm hoping that this encourages the government to do more events for the people of Abaco.
I personally want to say thank you to the local staff, to the NGOs, and everybody that made this happen. We are a team together, and we make great things happen, and I am looking forward to working alongside them and with them to expand this life-saving surgeries, as enabling people to see better and change their lives for the better.
So seeing is a key to life. And whereas we appreciate that sometimes we lose our sight totally and then have to rely on our other senses, I think the sense of seeing is one that illuminates our world and don't darken it. And this intervention, as I said, is critical to our people, particularly when it could be solved. You don't have to go blind because of interventions such as this. Sometimes it's just too expensive for the least amongst us. And that's what makes this effort so laudable, that we're doing it free of charge to all these indigenous people who are now able to see. Seeing, as we always say, is believing. And if you can't believe if you don't see. In this instance, we are opening eyes so that they can believe what they see.
Brought to you by the Ministry of Health and Wellness.